Yeah. Now I will show you how to check the codes in CPT book. So if you have attended my intro class, you will be knowing that CPT book will be used for coding all kinds of procedures. So now I will tell you how to use this book. So this is the CPT 2024 book. In that, first take the contents page. In the contents page, go to the last topic. That will be giving you the name of index. So in the index, what we have to check is, so if you take the index, the page number will be 1081. So now pick this page. This will give you all the procedure names according to the alphabetical order. So now I will open it and show you. So in this index, all the procedures are arranged according to the alphabetical order. This is called as alphabetical index. So now I'll open it. So you can see here, under the letter A, you can see all the procedures that belongs to the alphabet A. So now I will tell you a procedure. The procedure name is, you can check arthroscopy. Arthroscopy. So if you want the spelling of arthroscopy, I will just type it. Yeah, now I'm typing the spelling of arthroscopy. The meaning of this procedure is visualization of the joint space with camera. Visualization of joint. Joint means where two or more bones meet. In that region, they are inserting a camera and visualizing that. So now you pick up that word arthroscopy. It will be in page number 1093. So you can take that. In that arthroscopy, go down to the word knee. So knee arthroscopy is the procedure I want to check. So take the page number 1098. Yeah. So now we are moving down to arthroscopy. Yeah, page number 1098, arthroscopy. Under that, we have to check the word knee. The code for knee arthroscopy is 29870. So now what we have to do is, we have to go to the 2 series codes that will be under the chapter musculoskeletal system. That is the second topic under the surgery heading. Under the heading surgery, you will be finding musculoskeletal system. Musculoskeletal system means it's related to muscle and bone. This chapter codes will always start with number 2. So now I'm going to take that chapter, and in that chapter I'm going to find the code 29870. So now I'm picking it up. So as this is the PDF, I am showing you everything in the PDF. In your book, I think the page number will be 204. So you can also simultaneously open that. So I have got the code 29870. So now you can check the code 29870. It is arthroscopy, knee, diagnostic procedure with or without synovial biopsy. Now read 29871. It is also showing the same thing, arthroscopy, knee. But can you make out any difference in it? Yeah, the difference is, the first procedure is diagnostic. The second procedure is surgical. So diagnostic procedure means it is done to find out the problem inside the knee joint. But surgical procedure means I am treating the knee joint with surgery with the help of arthroscopy. I am going to insert a camera inside the joint, and with the help of it I am going to do some surgery on the knee joint. So in this 29871, the procedure done is infection, lavage and drainage. So the patient has got some infection in the knee joint. The doctor is going to clear it out. So that is what done in 29871. Now, starting from this 29871 till 29887, all the procedures are part of this knee arthroscopy surgical procedure. So how they do this procedure? 29873, it is also arthroscopy, knee, surgical with lateral release. So like that only you have to read 29873. 29873 just says it's done with lateral release. So it looks incomplete, no? So what we have to do is we have to add these words: arthroscopy, knee, surgical with lateral release. So this is the main procedure. This is an additional procedure. So till this semicolon symbol, the procedure is common from the code 29871 till 29887. Now I'll read you one more code. If I read 29877, how I will read it? Arthroscopy, knee, surgical with debridement or shaving of articular cartilage. So this is the whole procedure in 29877. Now you can try reading this 29882. How you will read it? You will read it as arthroscopy, knee, surgical with meniscus repair. So that is the way we have to read it. Okay. So this is how we will be reading the codes in the CPT book. Now I'll tell you other things in the CPT book. On the top corner of all the pages, you can see the topic name and also the list of codes in that particular page. For example, the page I am showing, you can see that it belongs to E&M chapter, and the codes in this pages are 99415 to 99416. Like that you can see in all the pages. Now just go to the bottom of the pages. On your left hand side, you can see the page number first, and then you can see some symbols there. Now I'll explain you the symbols that are given there. The first symbol what you're seeing is called as a star symbol, which will be used for a telemedicine consultation. That means whenever you see a star symbol before a code, it says that that code can be used for a telemedicine consultation also. That means patient is not directly visiting the doctor. Telemedicine means it is done from a far distance. So doctor and the patient are not directly meeting. No face-to-face visit is done here, but only from distance, maybe through a phone call or a video call, they are discussing about the condition of the patient. So that is about star symbol. The next symbol what you are seeing is actually a speaker symbol, which will be used for audio only. That means patient and the doctor are discussing about the patient's condition only through an audio call, no video call. It is not an online evaluation, it is just through a telephonic call they are doing the consultation. So that is about the speaker symbol. Now we will move to the third symbol, which is on the left hand side, that is a plus symbol. When you see a plus symbol before a code, it says that that code is an add-on code. Add-on code means it will never stand alone. This code has to be paired with some other code, and add-on codes will always be reported in the second place. So add-on codes are never primary and never reported alone. For example, you can see this code 99292 with a plus symbol. That says that this code will never be reported alone. So this code will be paired with the code that is given above that is 99291. And always below an add-on code, you will see with which primary code you will be using the add-on code. So now how should I report this 99292? Whenever I am reporting this 99292, it will be reported as 99291, 99292. Always report the add-on code in the second place. Keep that in mind, it's always secondary. The next symbol what you are seeing on the left hand side is a lightning symbol that is not needed for us. So we will move to the next symbol, that is a hashtag symbol. Whenever you see a hashtag symbol before a code, it says that it is a resequenced code. What is the meaning of resequenced code? Resequenced code means the code is not in its order. For example, we know that numbers will be following a definitive order, 1, 2, 3, 4, 5, like that. But sometimes in this book, they will change the order of numbers. Like, I will remove 3, that is between 4 and 5, and put it somewhere else. It can be somewhere else like 10 and 11 or 12 and 13. Like that, I can place that 3. And before such a code, I will be using a hashtag symbol. Here, you can see an example. After number 49, you can see 451. So after 49, it should be 50. But here, they have written 51. So before that 51, they have used this hashtag symbol. And in the place of actually this 51, after 50, 99450, they will mention that this 99451 is out of numerical sequence. You have to see this between 99448 and 99455. In between these codes, you can find this 51. That is the meaning of resequenced code. Next symbol what we have to learn is a circle with a bar, like a no entry signal. That means that with that particular code, you cannot use modifier 51. In my modifiers video, you would have learnt about modifier 51. Modifier 51 will be used for multiple procedures, but with some procedures you can never use modifier 51, and before such codes they will use this symbol circle with a bar. Now we will move to the right hand side of it. On that you can see the first symbol as a triangle symbol. Whenever you see a triangle symbol in front of a code, it says that this code has been revised. That means last year the code and the procedure description was little different, but this year we have made some changes in it. To describe the changes that they have made, they will put a triangle symbol in front of a code. And after that you can see a dot or a circle symbol. Whenever you see a dot or a circle symbol before a code, it says that the code is newly introduced into this book, and last year this code was not at all there, but now this was recently introduced into this 2024 edition. So that is the meaning of a dot or a circle in front of a code. This much of symbols is enough for us. And regarding these symbols, in your exam or when you are working, you won't be using these symbols for reporting, but in the exam sometimes they might ask you questions like this: what is the meaning of hashtag symbol, what is the meaning of triangle symbol, like that they can ask you. Otherwise there is no importance of these symbols in the exam and work. But whenever you come across a symbol before a code, you will be getting surprised. What is this? Why there is a symbol? So that is why I have explained these symbols. This will make you use the CPT book effectively. Thank you.